So first we're going to start with the ascending aorta. That's this part right here, and you guys already know that. I also want to talk about two blood vessels that are on your structure list for the heart. One is the right coronary artery, which runs right along here, and that's underneath the right auricle. And then there's the left coronary artery, which is over here, running underneath the left auricle. So from there, from the ascending aorta, we're going to go up. Blood flow is going to be taken to the common carotid over here, which goes up towards the head, and it's also going to be taken out towards the shoulder by the subclavian artery. So this is the subclavian. It would be sitting underneath your clavicle, and this one's on the left side. But when you come over to the right, you'll notice that there's this extra little bit. This extra piece right here, only on the right side, is called a brachiocephalic trunk. If we were to tag it, it would be right here. From there, it goes into the right subclavian, just like on the left side, and then up to the common carotid on the right side. So at the top of the common carotid arteries, you'll see a bifurcation, or a splitting is the word that means. So up here, common carotid splits into an external carotid artery and an internal carotid artery. So external is more anterior, internal more posterior back there. Okay, and then as we come down, we'll look behind the heart. I can take him off. Behind the heart is the thoracic aorta sitting here, and then you can find the abdominal aorta and the abdominal cavity down here. It splits off into the left and right common iliac arteries. So these are the common iliac arteries as they come down, and you'll see that split again. So going in to the pelvic cavity is going to be the internal common iliac or internal iliac, and then there's the external iliac that continues down. So make sure you know that the common iliac turns into the external iliac over this way. On this side it's easier to see, so we have common iliac continuing into the external iliac after we have the internal. And then down at the bottom, this is where it turns into the femoral artery. So as soon as it comes off of the pelvis and into the femur, we're looking at the femoral artery there. So for veins, now we're going to go through those. You guys know the superior and inferior vena cava. So superior vena cava, inferior vena cava, sitting in the heart just like that. It's going to come up and it kind of mirrors the same thing that your arteries do. So we have these subclavian veins on either side, and then we have what's called jugular veins coming up towards the head. They also have a split. Those jugular veins split a little differently. So the one forward, the more anterior, is going to be the internal jugular vein, and the one posterior is the external jugular vein. Okay, so that's what's important there. We'll come back here. There's nothing to see as far as veins go. And then down in the abdominal cavity, you'll find the inferior vena cava coming all the way down. And then there's common iliac veins as well that travel. This is a little harder to see on this side, easier to see on the right side of the body, common iliac vein. And then down at the base, same principle applies here. It would be called the femoral vein as it comes down towards the thigh. The last thing to note is going to be about our liver. The liver sits in the body just like this. You'll see this really big blue structure. That's again the inferior vena cava, so that would be labeled there. But the important thing to note is on the underside, you'll see this little blue vessel, which is a vein, and this is called the hepatic portal vein. Your structure list mentions a hepatic vein, which is not visible on this. So if you see this tagged, it is the hepatic portal vein. And I think that's everything you guys need to know.